Stop right now if you are taking magnesium glycinate every single day and you don't know this one thing, because this small mistake could be the reason you are not sleeping better, your anxiety is not going down, your muscles are still cramping, and your energy is still low, even though you have been taking this supplement religiously for weeks or even months. Millions of people started taking magnesium glycinate because it is known as the gentle, calming, sleep-friendly form of magnesium. But almost nobody talks about the mistake that cancels out all of its benefits. Today on Health Pathway Hub, we are going to break down exactly what this mistake is, why it happens, and how you can fix it starting today. So stay until the end because the last part of this video could completely change how your body responds to this supplement. Let's start with why magnesium glycinate became so popular in the first place. Magnesium is involved in over 300 biochemical reactions in the body, everything from muscle relaxation to nerve function to blood sugar control to producing energy at the cellular level. Most people are deficient in magnesium because of soil depletion, processed food diets, high stress levels, excessive caffeine, and alcohol consumption. Magnesium glycinate is often recommended because it is bound to glycine, an amino acid that has its own calming effect on the nervous system, and because this form is much easier on the stomach compared to magnesium oxide or magnesium citrate, which often cause diarrhea and cramping. So on paper, magnesium glycinate looks like the perfect supplement, gentle, well-absorbed, and calming. But here is where the mistake begins. The number one mistake people make with magnesium glycinate is taking it at the wrong time in relation to food, other minerals, and their medications, without understanding how this timing destroys absorption. Magnesium competes for absorption with calcium, zinc, and iron. If you are taking multivitamin, a calcium supplement, or a zinc supplement at the same time as your magnesium glycinate, you are literally creating a competition inside your gut, where these minerals fight for the same absorption pathways, and magnesium often loses that fight. This means you could be taking a high-quality magnesium glycinate supplement every day and still barely absorbing any of it because you are taking it alongside the wrong combination of nutrients. This is one of the most overlooked reasons people say things like, "I have been taking magnesium for a month and I don't feel any different." The second part of this mistake is dosage timing throughout the day. A lot of people take their entire dose in the morning because that is when they remember their supplements, but magnesium glycinate is most effective when taken in the evening, roughly 30 to 60 minutes before bed, because of its calming effect on the nervous system and its role in regulating melatonin production. When you take it in the morning instead, you miss out on the sleep-supporting benefits, and if you are someone dealing with anxiety, restlessness, or poor sleep quality, taking it at the wrong time means you are not getting the therapeutic window when your body actually needs that calming support the most. Now here is something even more important that most videos on this topic completely ignore, and that is the relationship between magnesium and your kidney function. If you have any form of kidney impairment, even mild and undiagnosed, taking magnesium glycinate daily without medical supervision can lead to a dangerous buildup of magnesium in your blood, a condition called hypermagnesiemia. Symptoms of this can include nausea, low blood pressure, irregular heartbeat, muscle weakness, and in severe cases it can affect your heart rhythm. This is exactly why blindly taking high doses of any magnesium supplement without knowing your baseline kidney function is a mistake that could be doing more harm
than good, especially for older adults or anyone with a history of kidney issues, diabetes, or high blood pressure. The third mistake is even simpler but extremely common, and that is inconsistent dosing. Magnesium does not work like a fast-acting painkiller where you take it once and immediately feel results. Magnesium glycinate needs to build up steadily in your system over a period of weeks to properly restore cellular magnesium levels. If you take it for 3 days, skip a week, then take it again randomly, your body never reaches the therapeutic saturation point needed for you to feel the calming, muscle-relaxing, sleep-improving benefits people talk about online. Consistency is not optional here. It is the entire foundation of whether the supplement will work for you or not. Another mistake that ties directly into this is not drinking enough water while supplementing with magnesium. Magnesium relies on proper hydration to be transported and utilized efficiently in the body. If you are chronically dehydrated, even a high-quality magnesium glycinate supplement will not perform the way it should, because your kidneys and cells need adequate fluid balance to move magnesium where it needs to go. This is why some people report bloating or digestive discomfort, even with the gentler glycinate form, because their hydration levels are not supporting proper absorption and processing. So now let's talk about how you actually fix all of this, because knowing the mistake means nothing if you don't know the solution. First, always separate your magnesium glycinate from calcium, zinc, and iron supplements by at least 2 hours, This alone can dramatically improve how much magnesium your body actually absorbs. Second, shift your dosage to the evening, ideally 30 to 60 minutes before you go to sleep, so you are working with your body's natural rhythm instead of against it. Third, if you have any underlying kidney concerns, high blood pressure, diabetes, or you are over the age of 65, talk to your doctor before starting any magnesium supplement and ask for a simple blood test to check your kidney function and current magnesium levels. This single step can prevent serious complications down the road. Fourth, commit to consistency. Take your magnesium glycinate at the same time every single day for at least 4 to 6 weeks before deciding whether or not it is working for you, because your body needs time to rebuild its magnesium stores. And fifth, make sure you are drinking enough water throughout the day, because hydration is the silent factor that determines whether the supplement actually gets utilized or simply passes through your system without doing much at all. It is also worth mentioning dosage itself. Many people either take too little to see any real effect, or they take excessive amounts, thinking more is automatically better. For most healthy adults, a range between 200 to 400 milligrams of elemental magnesium per day is commonly discussed, but this can vary significantly based on age, sex, existing health conditions, and other medications you may be taking, which is exactly why a conversation with your healthcare provider matters more than following a random number you saw online. The truth is, magnesium glycinate can be an incredibly supportive supplement for sleep, stress, muscle recovery, and overall nervous system health, but only when it is used correctly. The mistakes we covered today, poor timing around other minerals, taking it at the wrong time of day, ignoring kidney health, inconsistent use, and inadequate hydration, these are the hidden reasons so many people give up on magnesium glycinate, thinking it simply does not work for them, when in reality, they were never giving their body the chance to actually use it properly. If this video helped you understand something you did not know before, make sure to like this video, subscribe to Health Pathway Hub for more evidence-based health, and turn on notifications so you never miss the next video that could change the way you approach your own health. Drop a comment below and let us know if you have been taking magnesium glycinate and whether you noticed any of these mistakes in your own routine. And remember, this video is for educational purposes and is not a substitute for professional medical advice, so always consult your doctor before starting or changing any supplement routine, especially if you have existing health conditions or take other medications.